We're talking hip flexors and quads this morning, and there seems to be a massive amount of info out there as to whether your hip flexors are tight, whether your quads are tight, whether your hip flexors are weak, whether they need lengthening. And the big thing that certainly we're seeing in a lot of personal trainers and people who want to improve is that they're looking at releasing their hip flexors and they're looking at releasing their quads, and one might be tight for a reason and the other might be tight for a reason, one might be weak for a reason and then the other might be weak for a reason. So you really need to be informed about whether you're loosening the right thing, and also if you're not and it gets worse, you need to know what's the purpose behind it. So I'm going to go through a quick bit of anatomy for you for hip flexors, but then also a quick bit of anatomy about your quads as well. So here's our trusty Skelly. He's only a mini version. Hip flexors basically run from just above or just beneath your rib cage in the front of your spine, and they attach around along the back. They join up with your iliacus muscle, which is here. So you've got the psoas version, which is the long bit through the spine, and you've got an iliacus section, which starts at your pelvis bowl. Basically what they do is attach onto the hip, and when it contracts, the knee gets pulled up. So that's your long version. As that contracts up, you get hip flexion. They're what we commonly refer to as your deep hip flexors. So they're starting here, attaching onto the hip joint, and when you contract them, they get deep. Obviously, as you can see, you can have tight hip flexors, and when they shorten, depending on what point they're short at, they can pull you into a flexed curve position, or they can pull you tight into an anterior tight position. It really is dependent on which bit of that hip flexor is tight. So if you know you have tight hip flexors, you want to know which bit of your hip flexor is tight as well. Okay, so that's the little bit of anatomy on there. You then move on to your quads muscle, and your quads muscle goes over two joints. So there's actually four parts to your quads muscle. There's the deep one, and then there's the three slips of your quads muscle that you see on defined muscle. And it attaches from the hip, various points on the front of the hip anatomy, and then it comes down into one common tendon that encloses your kneecap and sits just below your kneecap. So it's coming from the top bit here, and it inserts onto the base of your tibia, and it obviously encloses your patella or your kneecap. And the job of the quads muscle is to straighten the knee. Okay, so if you're kicking, you want a straight knee. The quads muscle, though, also flexes at the hip. So this attachment up here, when we pull on it, it allows the hip to flex. So in terms of hip flexion, you've got your deep hip flexors, and you've also got your quads muscle working. So certainly in Pilates or physio terms, we'd sort of class your deeper hip flexors as your iliopsoas, so your psoas muscle, and we'd class your more superficial ones to incorporate things like your quads. I mean, there's other muscles that obviously help as well, but if you just differentiate those two for today, that's what we're looking at. So if you want to do that movement there, lift the knee up. So if you're standing and you want to lift that knee up, it's going to be brought on by your deep and your more superficial hip flexors. Which one is dominant can also have an impact. And obviously, if your hip flexors are tight, they can pull your pelvis into varying positions as well. So we're just going to look at a quick couple of tests that we do. And they're called, this one is specifically a Thomas test. And I'm just going to say what we're looking for and what we're using it for, in terms of what you would then manage, or in terms of what you would glean from that information. Obviously depends on what we've seen with you. So I'll give you a little bit of an example of what your Thomas test looks at, and we'll go from there. So if I come and sit on the bed, I would generally start people quite close to the edge of the bed, get them to hold on and roll back, just kick that lead out of the way, and get them to lie knees down. I generally do it without a pillow, so it's reproducible, so that there's no chance that they've had a cheat in there, and I generally get them to hold with two hands, again, just so it's reproducible. What we're looking at is one knee, so I'll go with my right knee, and we're just letting that leg fall towards the ground, okay? And what we're looking at is the position that knee takes. So I'll then bring that leg up and then compare it to the other leg, okay? Now I'm going to have a tight hip flexor on this leg, and you can see my quad is pretty good. And on this leg, I'm going to have a tight quad, but an okay hip flexor. All right, so what are we actually looking for? So in terms of your quads muscle, we'll deal with that second. We'll do the hip flexor first. What we want is a relatively contained spine. So your knee is to the chest, really to hold your pelvis in position, and we're letting this leg fall to the floor. Now, if my hip flexor here is tight, which in my case it is a little bit, I'm looking for a gap under here, okay? So I'm looking in a normal hip flexor that my thigh is no gap under here, but I haven't arched my spine, okay? So I'm looking for my spine to stay in neutral and the distance, the gap here to here. Now, if I have a tight hip flexor, it's not going to let my hip drop, okay? If I've got a loose or a sort of standard hip flexor, it allows my hip to drop, and it can't go any further because we're dead, okay? But I don't want to have achieved it by arching the back, hence why this knee's here to keep the back flat, okay? So on this start position, your pelvis and your lower back stay stable, and we're releasing that leg as far as it can be, and that should just be a natural fall. It shouldn't be a push down there, okay? As a therapist, we might give it a little bit of a push just to see what the resistance is, but we're looking for flush to the bed in terms of hip flexor, okay? So on this leg, I can discount my hip flexor as an issue unless it was here, and if I can get it here that I've arched, then my hip flexor is an issue. Okay, so I would clock that as a tight hip flexor. In this case, mine here is a relatively normal standard length hip flexor, because obviously we can't test extension. Okay, in terms of the quad muscle, I'm looking at the length from above the hip to down and as it inserts to the knee. Okay, so my hip flexor will just leave as a standard hip flexor. If my quad was tight, my leg would sit out in extension, okay? Because it's stretched above the hip, it might not be able to get to 90 degrees to hang towards the floor. So I'm looking for a 90-degree hang at the hip for the quad, but also a stretch at the hip here for a quad, okay? If I've got a tight hip flexor and my knee is here, it's not discounting the attachment at the top, so just be wary of that as well. But if my hip is flush and my knee can come flush to 90 degrees, then that's an okay Thomas test. And again, I could give a push on there with my hand to see if it flexes any further with ease. Okay, so they're the two things that we're looking at in terms of the hips. What we're looking at in terms of front and back, if I just come around to the front here, is where the knee sits in terms of alignment. So if I know that my leg is good here, but it hangs out to the side, so it's being pulled that way, I might surmise that the ITB section is a little bit tight. Similarly, we're looking at, does it rotate in or does it rotate out? And does it cross the middle? So in terms of those tests there, what it's basically telling us is your hip flexor tight relative to your quads? Is your quads tight relative to your hip flexor? Do you have a tightness in your lateral compartment? So if we go back to our little friend here, if my knee line is sitting here, so if he's doing his test, and his knee line is in line here, great. But if his knee line is being pulled to the side, I might question the ITB section. If his knee line is being pulled in, I might question medial and adductors as well. So can the hip get flush to the bed without a tilt of the pelvis? Can the knee sit at 90 degrees and everything's in alignment? That's a pretty good Thomas test. If there's an amount of hip flexion, an amount of knee extension that isn't to 90, and if there's a little bit of variance in how that knee sits, either in or out, or rotated in or out, then we're looking at there being some sort of compromise, and that could be that one of the muscles is tight, it could be that one of the muscles is short, it could be that there's just a problem with flexibility. The main thing that you need to be aware of is then thinking, what are we doing for that? So if your hip flexors are tight, are they tight for a reason? Are they tight because you physically can't get pelvic extension? Are your hip flexors tight and short because they're compensating for something like weak glutes? Same thing with your ITB. If you find that you have tighter quads or you've got a lateral displacement, so your ITB is tight, is that tight because you're using that to hold you upright instead of using things like glute medial stability? So we sort of look at these tests in conjunction with what else we found. I think it, just be wary that if you go away and do your test and find that you've got tight hip flexors, and then you go, okay, I've got to smash my hip flexors and stretch my hip flexors, and then you find that, oh, actually that's not working, it's actually making it worse. If you take away what's holding you up, so if your hip flexors and your quads are actually holding you upright because you've got a weaker core, or your stability isn't that great because all the muscles don't work in unison and you're hanging off things like your quads and hip flexors, you're going to run into a few issues. So take it with a pinch of salt. We're using these as diagnostic tools in conjunction to things we've already found. So if we're finding somebody's got a weak glute med and they're using something else like piriformis, or they're using a tuck under and they're relying a bit more on quads and they're starting to get some knee pain, then we'll actually use that as a little bit of a, okay, where's your hip flexors at, where's your quads at? Yes, that makes sense. Your glutes are weak, you're tucking under a little bit, you're hanging off quads. Quads are then getting tighter to lock in to help stabilize you, and that's causing a bit of maltracking in your knee. So yes, you've got pain in your knee, but the actual issue is weak glutes. You might have, tight quads, and that's pulling on your kneecap and you're seeing it as pain, but it might be actually because your hip flexors are weaker or your core strength is weaker, so you're relying a little bit further down the chain. So take it with a pinch of salt. If you want to do some Thomas tests, that literally is a test for your hip flexor and your knee quads extension muscle, really having a look at length in relationship one to the other, and also which sections of it may be tight. Just be wary of just going crazy and releasing it, and maybe you might be releasing what's holding you up. Hope you enjoyed that, and we'll come back tomorrow with something else. Take care.